So you have bloating, acidity, and you feel dizzy and sluggish after eating. You feel heavy after eating, and then you want to doze off to sleep after eating. So all of this could be overcome by one simple thing which we teach our clients and patients, which has worked wonders. It is a small change, but it has given immense, I would say, overpowered result for everything. I mean, people have started noticing and lowering their HbA1c because of this is all change, which is the change of the sequence of food you're eating. So if you change the sequence of food you eat in a meal, this is that. So I call it as all right metaflow. And this is something which is designed to, give you a lower blood glucose levels, even eating the same kind of food. A very simple technique. You can overcome all of this. And when our patients and clients enroll with us on our programs, we always coach them on this one simple thing, which is the sequence you eat your food in. Now you're having the same meal you have, but in a different sequence, which will deliver you a different result. So, it's not only about what you are eating, it's also about how you are eating that same kind of food. And then again, it also have your lifestyle factors, your sleep, movement. And so what do we coach our patient? What is it? It is the way you start eating your meal. So let us get straight into it. I want you to start your meal with your raw first, which are your raw vegetables as the starter. So you can do cucumber slices, carrot slices, beetroot, radish, and then you switch to your cooked vegetable like okra, butter dal, hanke, whatever you're having for that meal. And then you go to your visible proteins like pasture raised eggs, maybe ethically sourced paneer, or you can do your seafood if you want to eat beef and whatever. And then you go to your fats. Maybe you are having some coconut, walnut, let's say flaxseed for omega 3. And then we go to your carbohydrates, which are your rice, the millet, maybe coffee wheat flour roti. And that is how you do it. And if you want to eat a fruit, eat it after your meal, again, in the place of carbohydrates as a dessert. Now, this is a small change in how you're eating, but it will deliver you big results. Always remember small changes, but with consistency, it's going to be more and more beneficial than just do it one thing, not in a consistent manner. So, why is it helpful? What is it doing actually? So, this is a protocol which would help you to lower your blood glucose spike. And this has helped a lot of our patients to do that. I mean, we just have put them on this protocol that is called as all right meta flow. And we, when we, give them lifestyle plan, just put this sequence in their diet. This is amazing. But what if you're eating a meal which may not go with this sequence? Then there's a way. Drink apple cider vinegar 30 minutes before having your meal. And along with that, try to eat again vegetables first. So let's say you're just having dal rice with some raw vegetable salad. Again, eat your salad first and then take a large portion of dal and that small portion of rice in your spoon. So let's say I'm doing a 1 teaspoon. I'll make 70% by volume of hulks or dal and then 30% with rice. And then I'll eat. And even if you are having an Indian thali, it is very visible there because let's suppose you're having a millet roti and then you're having a cooked vegetable, a dal, and some pickle or salad. So what do you start with first? I want you to answer right now. Your raw vegetable first, absolutely. And then you would go to your cooked vegetables. So let's suppose you're having a mixed vegetable. Now you would think, how would I eat only vegetable and then I'll eat dal, and then I'll eat that millet roti. What you could do here is take a small, tiny bite of that millet roti, a big portion of vegetable, and dip it in dal and then eat. But even if you're unable to do that, do not worry because that worrying will be more detrimental to your health than that sequence of food you're eating. So, if you're eating your meal in a normal way, enjoy it too fully and do not create stress that I'm not eating this particular sequence and it would raise my blood glucose level or whatever. Do not create this thought, but rather just enjoy your meal and have apple cider vinegar 30 minutes before it, and then cherry on top. Walk for 10 minutes after your meal, which we generally call as postprandial walk. Again, this has also delivered the patients and clients amazing results with their health. So, what are some benefits of this practice, this sequence? Now, it is gonna help you feel less acidity, gas, and bloating. So essentially, you are eating your vegetable first, and then your cooked vegetable, pulses, your protein, fats, and carbohydrate. Now, till the time you reach your carbohydrates, most of you will feel that you do not need that carbohydrate, your millet, your rice, and then you realize you were overeating in the first place. Because when we sit down to eat, and it's in our plate, we don't consciously then choose what we are eating. So it just goes into our mouth without our knowing. And then we feel bloated, we feel so full, we want to sleep after eating and it results in you getting more weight. And that is why calorie restriction works because you're just eating less amount of food. But here, essentially, you're eating the right kind of food in the right proportion, and then you are eating on the basis of the need of your body rather than a piece of paper or a mathematic equation. And it would also be super beneficial if you are on a weight loss journey. It would help you to lose weight because you're essentially you know, filling yourself up with fiber, protein, and fats. And that if you are still hungry, then you're doing your carbohydrates. So what happens here is that when you eat your vegetables starter first, it creates a mash. It has fiber. It fills you up. So it gives you a feeling of fullness. So it lot lesser than you would have. And it would also help you to lower your blood glucose spike. You would notice this, that you're having your same meal in a different sequence, in a sequence which you're eating right now, which is mixing everything up and then eat it. And then you follow this all right meta flow sequence, you would notice a result in your blood glucose levels that with meta flow, you have lower blood glucose spike that when you were eating normally. And again, this is because of the fiber, the sequence which we have formulated so that it works at a cellular level in your body. So that is why the lifestyle is the cure to most of the disease we have today. It's not just about one diet plan, it's actually an integrated approach. What else? It's not only good for people with diabetes or insulin resistance, but it is actually good for everyone. It's like fundamental thing which we all should be knowing and it should be taught to us in our school. But nutrition is not taught to us in the schools, and that is why I'm here to help you with this one simple change which you could make right now today. It takes nothing from you. You just need to experiment with it, look at the thing with a deep perspective, and then see it for yourself. Biggest benefit personally I noticed from this thing is that it is not causing you bloating. And then most of you have a problem of digesting food you're eating. You say, I'm eating the right kind of food, still not able to digest it. It could be because you were eating in the wrong sequence, or even if you're eating in the right sequence, maybe it's the proportion size, or you're already full by the time you are eating, your whole plate, and then you miss out on the signal of fullness, and then you eat and overeat everything. Today, most of everyone, so we were talking about insulin resistance, and I would want to make a point that most people today have a insulin spike on a daily basis. And we may not notice this because it's like if we cannot see it, but we can feel it, but we blame it on everything which is outside, maybe our age, maybe the weather condition, maybe it's just our mood. But your gut plays very important role. I mean, it's like 90%. And that is what you feel. Sometimes you feel anxiety, sometimes you feel stress. You don't know why you are feeling that. It's because of your insulin spike. But it's something which we are not aware of. So we don't even comprehend it as such. We just move it with our lives. Our lives goes on without we consciously noticing that. So if you want to stop the insulin spikes every day, because people eat anything and then it would spike the insulin and then they feel more hungry. So this metaflow lowers down that insulin spike, and insulin spike is not only for people with diabetes. It's not there. It is for cardiovascular diseases, for PCOD, obesity, eczema, you name it, Alzheimer's, dementia, cancers as well. It's not the fats or saturated fats. It's mostly about insulin resistance and chronic inflammation, which this sequence would help you to lower down. So if you want a glowing skin, if you do not want acne on your skin, if you want that vitality, this flow again is gonna work wonders. Give this a try. This is gonna take nothing from you, but it is gonna give you and leave you with a better result. I mean, you can choose what you want to do after this. Thank you for watching.